The truth revealed. What blood pressure can save the lives of the elderly? Did you know that the ideal pressure for an elderly person may be different from that recommended for younger people? Ever wondered why so many elderly people suffer from side effects of hypertension medications? Are you curious to find out if the new blood pressure parameters are really safe for those over 65? Hypertension is a condition that affects millions of elderly people around the world, but what few argue is that standardized treatment may not be the most appropriate for everyone. The balance between controlling blood pressure and maintaining quality of life becomes a complex challenge with advancing age. Every beat of your heart counts, and every millimeter of mercury can make the difference between living well or just surviving. The new medical guidelines have sparked intense debate, questioning whether what is considered ideal for young adults really applies to older adults. Are you ready to discover truths that can completely change your view of cardiovascular health in old age? Let's get started. What happens in your body when blood pressure rises with age? Over the years, our body undergoes silent transformations that directly impact blood pressure. Natural aging causes structural changes in blood vessels, which tend to lose elasticity. This stiffness hinders blood circulation, increasing the pressure inside the arteries. Another important factor is the hormonal changes that accompany aging. Hormones such as renin, which regulate blood pressure, decrease their production over time. This reduction affects the body's ability to maintain an optimal pressure balance. In addition, the kidneys, which are fundamental in controlling blood pressure, also lose efficiency over the years. The natural changes of aging transform cardiovascular physiology in ways that traditional medicine doesn't always take into account. These changes make hypertension a more prevalent condition in the elderly, even without a family history. It is common for blood pressure to gradually increase as one reaches old age. However, the problem is not only the increased pressure, but the complications it can bring. Cardiovascular diseases such as heart attack and stroke are more common in people with high blood pressure. In addition, uncontrolled hypertension can lead to damage to vital organs like kidneys and eyes. Therefore, it is crucial to identify these changes and treat hypertension properly, respecting the particularities of each organism. However, intensive treatment to reduce blood pressure also carries risks, especially in frail older adults. Falls, fainting, and kidney problems are some of the possible complications. Understanding how the body reacts over time is the first step towards more efficient and safer care. But have you ever stopped to think if the treatment your doctor prescribed considers all these natural changes in your body? Dangerous numbers. The dilemma of ideal values between young and old. Traditional guidelines have always indicated 120/80 as the ideal blood pressure for adults. This number is widely known, and for many, represents the synonym of cardiovascular health. But can this same goal be applied to all the elderly? Aging brings natural changes to the body that directly affect blood pressure. Blood vessels lose elasticity, kidneys can become less efficient, and the hormonal system begins to function differently. Therefore, it is normal to see a gradual increase in blood pressure, even in healthy people. Recent studies have shown that lowering blood pressure in older adults to extremely low levels may not be safe. Although controlling high blood pressure is essential to prevent diseases such as heart attack, stroke, and heart failure, it is necessary to be careful with extremes. Treatment goals should not be determined by numbers alone, but by the balance between cardiovascular risk and quality of life. Pressures that are too low can cause dizziness, fainting, and falls, which for older adults pose a significant risk of fractures and hospitalizations. New guidelines, such as those proposed by the American Heart Association in 2017, have begun to adopt more aggressive targets. In them, hypertension is diagnosed in readings of 130/80 or more. This means that many elderly people who were previously considered within normal limits are now diagnosed with hypertension. For some doctors, these new criteria have benefits, as they encourage stricter control of blood pressure. However, for older adults who are frail or have multiple comorbidities, reaching a level of 120/80 may require strong medications that have serious side effects. Therefore, The ideal numbers for seniors are not universal. Each patient should be evaluated individually, taking into account their medical history, lifestyle, and physical ability. The balance between benefits and risks is essential to ensure a healthy quality of life. If blood pressure is above 140 or 150, appropriate treatment may be necessary. But the search for excessive control must be done with caution and always under medical guidance. What if I told you that what you consider normal pressure could be putting your health at risk? Revolution in protocols, the new guidelines that are changing everything. The guidelines for the diagnosis and treatment of hypertension have undergone major changes in recent years. In 2017, the American College of Cardiology and the American Heart Association updated the criteria, lowering the threshold for diagnosing high blood pressure. Previously, a blood pressure of 140/90 was considered hypertension for younger adults, while 150/80 was the standard for seniors over 65. With the new guidelines, these numbers have changed. Now, a blood pressure of 130/80 or higher is considered hypertension. Normal blood pressure is defined as less than 120/80, and values between 120 and 129 for the upper number are considered elevated. These changes were made based on studies that demonstrated the benefits of lowering blood pressure more aggressively, lowering the risk of cardiovascular diseases such as heart attack and stroke. However, this new approach has brought challenges, especially for older people. Modern medicine is rethinking its most fundamental convictions about hypertension, finally recognizing that age brings specific needs that cannot be ignored. Many experts question whether these goals are safe or even realistic for older people. In an older person, achieving a blood pressure below 120 may require high doses of medication, which often result in adverse effects. These effects include dizziness, fainting, falls, and even kidney damage. In addition, there is an important point to consider: quality of life. The search for very low blood pressure can compromise daily well-being, especially in frail elderly people or those with multiple chronic diseases. Therefore, changes in guidelines require more careful consideration in elderly patients. The doctor must evaluate not only the numbers, but also the patient's general health condition, medical history, and risk of side effects. Rather than following rigid goals, treatment should be personalized. For many older adults, a systolic pressure between 140 and 150 may be safer and more appropriate than forcing extremely low numbers. The most important thing is to find a balance between the benefits of blood pressure control and the risks of aggressive treatments. Do you wonder if your current treatment is really suited to your specific needs? Vital code: deciphering the numbers that determine your future. Knowing how to interpret blood pressure numbers is essential for making informed decisions about your health. Blood pressure is measured by two values: systolic pressure, the top number, and diastolic pressure, the bottom number. But what do these numbers really mean? And how do they affect you, especially as you age? Systolic pressure represents the force with which the heart pumps blood to the arteries. With aging, it is common to see an increase in this measurement due to the stiffening of the blood vessels. Diastolic pressure indicates the resistance of the arteries when the heart is at rest, between beats. According to modern guidelines, the values are classified as follows. A normal blood pressure is considered to be below 120/80, between 120 and 129 in systolic, with less than 80 in diastolic. Each number on your blood pressure measurement tells a story about what's going on inside your arteries, revealing secrets that could determine your tomorrow. Stage 1. Hypertension occurs when the systolic pressure is between 130 and 139, or the diastolic pressure between 80 and 89. From 140/90 or more, it is considered Stage 2 hypertension. For the elderly, these values may raise doubts. Many wonder, if my blood pressure is 140, do I really need to take medication? The answer is not simple, as it depends on various factors such as your overall health, medical history, and the presence of other conditions such as diabetes or kidney disease. Studies show that in the elderly, pushing blood pressure to very low levels, such as 120/80, can pose significant risks. Dizziness, fainting, and falls become real concerns, especially in more fragile people. A fall can lead to serious fractures and compromise quality of life. On the other hand, leaving high blood pressure unchecked is also dangerous. Pressures persistently above 150 can increase the risk of stroke, heart attack, and heart failure. That's why, for many older adults, a systolic pressure between 140 and 150 can be a safer and more balanced goal. The key is to understand that numbers are only one part of the equation. The approach must be personalized, considering the individuality of each person. Working together with your doctor to find the most appropriate goal is essential to avoid risks and promote a healthier life. Finally, remember, numbers have the power to save lives, but it is the correct interpretation of these values, combined with common sense and medical monitoring, that will really make a difference. What do you think about reevaluating your current values with a new look, considering your age and health condition? Sprint for Life, the study that forever transformed the treatment of hypertension. One of the most important studies that changed the way we treat blood pressure was the SPRINT study, or Systolic Blood Pressure Intervention Trial, published in 2015. This study was revolutionary in showing that lowering systolic blood pressure to lower levels could have significant benefits, especially in preventing cardiovascular disease. The study involved more than 9,300 participants aged 50 and over, all of whom were at high risk of heart disease, but had no diabetes or a history of stroke. These participants were divided into two groups. The first group followed a standard treatment, with the goal of keeping systolic blood pressure below 140 millimeters of mercury. The second group, in turn, underwent more aggressive treatment, with the aim of reaching levels below 120 millimeters of mercury. After 3 years of follow-up, the results were surprising. The data from the SPRINT study has lit a red flag in the medical community. Life-saving numbers can also create new risks. The intensive care group showed a significant reduction in serious cardiovascular events, such as infarction and stroke. In addition, the mortality rate in this group was lower compared to the group that followed standard treatment. The numbers speak for themselves. About 2.19% of participants in the standard group had serious cardiovascular events over the course of a year. In the intensive care group, this rate dropped to 1.65%. This result proved that for many patients, reducing systolic blood pressure below 120 could save lives. However, the benefits came with important challenges. The intensive care group also had higher rates of adverse effects, such as drops in blood pressure, hypertension, fainting, kidney problems, and electrolyte imbalances. These side effects have raised concerns, especially when we talk about frail elderly people or those with multiple health conditions. This study made it clear that while aggressively lowering blood pressure has benefits, it should be applied with caution in older adults. Risks and benefits need to be carefully evaluated, and treatment should be tailored to the individual needs of each patient. Therefore, the results of the SPRINT study are a fundamental piece in understanding hypertension in the elderly. They show that, although the guidelines point to lower goals, not all patients benefit from such strict control. For many, keeping their blood pressure around 130 or 140 may be a more balanced approach, ensuring safety and quality of life. The SPRINT study was a revolution, but also a wake-up call. The treatment of high blood pressure needs to be personalized, especially in old age. What works for one patient may not be suitable for another, so medical monitoring is essential. Does your current treatment take into account this balance between benefits and risks? The trap of over-control, when drugs turn risks into real dangers. Controlling blood pressure is essential to prevent serious diseases such as heart attack, stroke, and heart failure. However, aggressively lowering blood pressure, especially in the elderly, can have unexpected and dangerous consequences. The SPRINT study highlighted the benefits of intensive treatment, but also revealed that this approach is not without risk. Participants who followed stricter goals, such as keeping their systolic blood pressure below 120, had a higher incidence of significant side effects. Among the most common problems associated with intensive care are: first, hypotension. When blood pressure drops too low, especially in the elderly, symptoms such as dizziness, weakness, and blurred vision can appear. These sudden drops in blood pressure can lead to fainting, increasing the risk of falls and fractures, which are especially dangerous for the elderly. Second, electrolyte imbalances. Many medications used to treat hypertension affect the balance of electrolytes like sodium and potassium. The medicine it is supposed to protect can become a silent threat, creating a vicious circle of new problems that require even more medication. These imbalances can cause complications such as cardiac arrhythmia, muscle cramps, and even changes in brain function. Third, kidney damage. Aggressive drug treatment can overload the kidneys, leading to acute injury or aggravating existing kidney problems. For older adults, who often already have a reduction in kidney function due to age, this is an important concern. Finally, the drop in quality of life. In many cases, the combination of medications and the resulting side effects can affect the patient's overall well-being. Symptoms such as constant fatigue, nausea, and mood swings can hinder the daily routine and compromise the autonomy of the elderly. These risks highlight the importance of personalizing treatment for each patient. Not all seniors benefit from extremely low blood pressure goals, especially if the price to pay is a number of debilitating side effects. Therefore, it is essential that doctors and patients work together to find the ideal balance. More conservative control, such as keeping systolic pressure around 140 or 150, may be safer for many older adults, reducing risk without compromising benefits. Additionally, regular monitoring is essential. Monitoring the effects of medications, adjusting doses when necessary, and paying attention to warning signs are key steps to ensure the safety of treatment. In the end, the goal of treatment should go beyond the ideal numbers. It should prioritize the patient's overall health and quality of life, ensuring that blood pressure control does not become a burden, but rather an effective form of protection. And now, can you identify if you are experiencing any side effects from your treatment? Eastern Wisdom: What the Chart Study Taught the World About Healthy Aging. Another landmark study in the field of hypertension was the CHART study, conducted in 2021. This study looked at more than 20,000 Chinese adults aged 60 to 80 years to understand the effects of different approaches on blood pressure control. The findings provided valuable insights into how to treat hypertension in older adults, especially in high-risk populations. The CHART study compared two main groups. The first group received intensive treatment with the aim of reducing systolic blood pressure to less than 130 millimeters of mercury. The second group followed a standard approach, aiming for a systolic pressure below 150. The results showed that intensive treatment significantly reduced the risk of serious cardiovascular events, such as stroke and heart failure. The survey of elderly Chinese has revealed a secret that many Western cardiologists still resist accepting. Optimal control varies depending on the person and their history. The impact was particularly positive in reducing strokes, one of the biggest concerns among older adults with hypertension. However, just like in the SPRINT study, the benefits came with challenges. The group subjected to tighter control had a higher incidence of side effects, including hypotension, kidney damage, and electrolyte imbalances. Despite this, there was a reduction in overall mortality, suggesting that, for some patients, intensive treatment may be beneficial as long as it is well monitored. The study highlighted another important point: the individualization of treatment. While some patients tolerated aggressive targets well, others experienced complications that compromised their quality of life. This reinforces the need to consider factors such as frailty, medical history, and the presence of other diseases when setting blood pressure goals. In addition, the study highlighted that age, by itself, should not be the only criterion for determining treatment. Healthy older adults, without multiple comorbidities, may benefit from tighter control. On the other hand, frail patients, or those at high risk of side effects, may need more conservative goals, such as keeping systolic pressure between 140 and 150. These lessons are especially relevant for physicians and patients seeking optimal balance in the treatment of hypertension. Blood pressure control is not a one-size-fits-all approach. It should be tailored to each person's needs, ensuring that the benefits outweigh the risks. The CHART study, like the SPRINT study, reinforces an essential truth. The patient's health must be at the center of any decision. The numbers are important, but it is the careful interpretation of these data that makes the difference. How do you feel knowing that there are different approaches to treating high blood pressure in the elderly? Throughout this text, we have seen that blood pressure, especially in old age, is a complex topic that requires special attention. Modern guidelines suggest more aggressive goals, such as keeping blood pressure below 130 or 120 millimeters mercury. These changes, while based on important studies like the SPRINT and CHART, are not always ideal for all seniors. Each person is unique. Factors such as general health, medical history, the presence of other diseases, and even lifestyle directly influence how the body reacts to hypertension and its treatment. Therefore, the decision about the ideal blood pressure goal should be made individually, always together with a trusted doctor. We know that proper blood pressure control can save lives. It significantly reduces the risk of serious diseases such as stroke, heart attack, and heart failure. On the other hand, the excessive use of medications to achieve very low goals can have adverse effects that compromise quality of life, especially in frail older adults or those with multiple comorbidities. The secret is in balance. Regularly monitoring blood pressure, adopting healthy habits, and making adjustments to treatment when necessary are essential steps to keep blood pressure within safe limits. After all, the main objective is not only to control the numbers, but to ensure a long, healthy, and quality life. So if you have hypertension, don't make rash decisions. Avoid fixating on numbers or rigid goals without professional guidance. Talk to your doctor, share your concerns, and seek a treatment plan that is appropriate for your reality. Remember that taking care of your health is a daily commitment, and small changes make all the difference. Maintain a balanced diet, exercise according to your conditions, manage stress, and monitor your blood pressure regularly. With these precautions, you will be well on your way to living longer and better. Finally, never underestimate the importance of dialogue with your doctor. Your body is unique and your needs are individual. Working in partnership with a healthcare professional is key to finding the safest and most effective treatment for you. Your health is in your hands, and the choices you make today will define your tomorrow. Value your well-being, take care of your blood pressure, and ensure a life with more energy, security, and tranquility. Controlling your blood pressure is not just a number to be achieved, but a path to a fulfilling life that you deserve to enjoy in every moment.